In this video, I'm going to walk you through the urine drug testing procedure, step by step. By the end of this, you'll be familiar with the process and ready to undergo it with confidence. When you arrive for your drug test, the first thing that happens is identity verification. The test collector will check your ID, such as a driver's license, to make sure you are who you say you are. Then they'll walk you through the procedure so you know exactly what to expect. Next, you'll be asked to remove any unnecessary items like jackets, hats, bags, and purses. They'll also do a quick check of your pockets and wallet. This is to make sure you don't have anything that could be used to cheat on a drug test. Rest assured, all your belongings will be securely stored while you're in the testing room. Next, you'll need to wash your hands. This ensures there's nothing under your fingernails that could potentially contaminate the sample. It's important to note that refusing to wash your hands is considered a refusal to take the test, which is treated the same as a positive result. After your hands are clean, the collector will open a fresh collection kit and hand you the collection cup. They'll escort you to the restroom, staying nearby to ensure the process is followed correctly. Once you're at the restroom, you'll receive final instructions. You have 4 minutes to provide a sample, you cannot wash your hands again, and you must not flush the toilet. Let's discuss the typical drug testing bathroom setup. There are 2 types of bathrooms that might be used. A multi-stall bathroom with several toilets, where the collector will wait outside your stall but inside the bathroom. A single-room toilet with the collector waiting just outside the door. In both scenarios, all handles are taped off or removed, and items like soaps or disinfectants are taken out to prevent tampering. The toilet water is dyed blue, and the toilet lid is taped down. Any potential hiding spots are also secured. If you find yourself unable to provide a sample due to a shy bladder, don't worry. The collector will give you up to 3 hours and offer 40 ounces of liquid to help. However, refusing to attempt to provide a sample or leaving the collection site before completing the test is considered a refusal, which again is treated as a positive result. There are specific situations when a directly observed drug test is required. The situation involves a return to duty or follow-up test. If the collector observes that the employee has brought materials to the collection site or behaves in a manner that suggests an attempt to tamper with the specimen. If the temperature of the original specimen was outside the acceptable range or the specimen appeared to be tampered with. The laboratory reports an invalid specimen without an adequate medical explanation. The medical review officer reports a negative dilute result with a creatinine concentration that's outside the normal range. During a directly observed drug test, a person of the same gender will observe you. Collector will accompany you to the restroom or urination facility. They'll ask you to lift your shirt, blouse, or dress above your waist or navel. You'll need to lower your clothing and underpants. Then you'll have to turn around to prove you're not wearing a prosthetic device. Once they check and see that you don't have the device, the collector will let you fix your clothes before they continue with the observed collection. You will then urinate into a cup under the collector's direct supervision, ensuring the urine transfers from your body into the collection container. The collector will then take the container, making sure it remains visible until it's in their possession. Refusing to follow any part of this procedure is considered a refusal, which is treated as a failed drug test. You must submit your sample within 4 minutes. Once you exit the restroom, the collector immediately checks the sample for any suspicious odor, temperature, or color. If the sample appears abnormal or tampered with, you'll be asked to provide another sample under direct observation. Next, you'll be escorted back to the initial room where additional paperwork is completed. The urine is then divided into 2 containers and sealed. Both containers are sent to a lab. The second container is reserved for a confirmation test if the first returns a positive result. You'll be asked to initial each seal. After the samples are sealed, you may wash your hands. You'll then need to provide your basic information on a form. The collector finalizes the paperwork, places the sample in a bag along with a copy of the form, and hands you a copy. At this point, you're free to leave. If you have any questions, feel free to leave a comment below. Don't forget to hit the like button and subscribe to our channel for more updates.